Hello, I am Dr. Durga Prasanna Misra, an Associate Professor of Clinical Immunology and Rheumatology at SGPGI, Lucknow, India, and I'm presenting my work related to novel T helper 17 lymphocyte populations in Takayasu arteritis, which is a large vessel vasculitis affecting the aorta and its major branches. Immune activation plays a role in driving the pathogenesis of Takayasu arteritis. However, novel T helper 17 populations Th17.1, which secrete both interferon gamma as well as IL-17, and PD1 positive T helper 17 lymphocytes, which secrete the pro-fibrotic cytokine TGF-beta1, have not been studied previously in Takayasu arteritis. So we studied peripheral blood T lymphocyte populations by flow cytometry and performed ELISA for cytokines in the serum, as well as cultured peripheral blood mononuclear cells from patients with Takayasu arteritis and evaluated in vitro the effect of tacrolimus, which is an immunosuppressive drug scarcely used in Takayasu arteritis, but commonly used in post-renal transplant and other scenarios, tadalafil, which is anti-fibrotic properties, and a combination of tacrolimus and tadalafil. We found that the novel T helper 17 populations, T helper 17.1 and PD1 positive T helper 17, were increased in Takayasu arteritis compared to healthy controls. So also serum interleukin 6 and TNF alpha. And in the PBMC culture supernatant, various inflammatory cytokines like interferon gamma, interleukin 17A, interleukin 6, TNF alpha, and interleukin 1 beta were elevated in Takayasu arteritis than healthy controls. Compared to a disease control group of sarcoidosis, T helper 17 cells, PD1 positive, CD4 positive lymphocytes were elevated in Takayasu arteritis than in sarcoidosis. So also was serum interleukin 6 and culture supernatant interleukin 6, TNF alpha, and interleukin 1 beta. T helper 17 lymphocytes associated with active Takayasu arteritis. And on longitudinal follow-up, T helper 17 lymphocytes, T helper 17.1 and PD1 positive T helper 17 lymphocytes reduced following immunosuppression. Also the serum cytokines interleukin 6 and TGF-beta1 and culture supernatant interleukin 6 reduced after immunosuppressive therapy. In vitro, tacrolimus reduced levels of most inflammatory cytokines with a further synergistic reduction of interleukin 6, interleukin 17A, interleukin 1 beta, and interleukin 10 with an addition of tadalafil to tacrolimus. So T helper lymphocytes play multifarious roles, including secretion of interleukin 17A, which drives vascular inflammation by drawing neutrophils, secrete interferon gamma, which drives granuloma formation, contribute towards corticosteroid resistance, and also drive adventitial fibrosis. There is a need to explore a therapeutic strategy combining immunosuppressive therapy with anti-fibrotic therapy in clinical trials of Takayasu arteritis, since it is the fibrosis that finally leads on to the vascular stenosis. Thank you.